Next, we have Dr. Remya Edachery. Her topic is on eyes wide open, the keratitis spike in a recent measles outbreak in North Kerala.
Good morning. My paper, Eyes Wide Open, the keratitis spike in a recent measles outbreak in North Kerala. No financial interest. Measles is caused by a virus of paramyxovirus family. It is characterized by fever, cough, coryza and a characteristic maculopapular rash. It's a highly contagious, serious airborne disease that can lead to severe complications and death. And in spite of the availability of an effective vaccine, it still remains a significant global health concern, particularly in regions of suboptimal vaccination coverage. So once it was thought to be under control, but recently it is researched in recent years, posing a significant challenge to the public health system. Primarily, it affects the respiratory and lymphatic tract, but the virus can also disseminate hematogenously, leading to systemic complications affecting various organs and tissues. Notably, the ocular manifestations of measles less common compared to the respiratory and neurological complications, but can have significant implications for visual health. The involvement of the eye in measles, termed as measles-associated ocular complications, that includes a spectrum of conjunctivitis, keratitis, uveitis, and retinitis. Of this particular concern is the keratitis, that is inflammation of the cornea that can lead to visual problem, pain, and photophobia. So studying the clinical features and outcomes will help the etiological features in measles. So the pathogenesis of measles includes, in keratitis involves a direct viral invasion of the corneal epithelial cells as well as immune mediated inflammation. So this is a study done in, it is a cross-sectional study, observational study done in patients who were admitted with the clinical features of measles with any symptoms or signs of ocular involvement from October 2023 to February 2024. So we took a detailed history including the general symptoms, ocular symptoms, vaccination history as well as exposure history. Demographic data were recorded. Slit lamp evaluation was done in detail to look for conjunctival and corneal involvement. Fluorescent staining was done in all patients to look for the different staining patterns, and then complete blood count and CRP were sent, and in suspected cases IgM measles antibody were also sent. So this is one of our patient with a characteristic maculopapular rash with conjunctivitis, and these are the different staining patterns. Coming to the results, the maximum number of patients were in the age group of 20 to 40 years, and fever with rashes were present in almost all patients, followed by mouth lesions, cough, sore throat, and loose stools. Symptoms, redness was present in 83.3%, followed by foreign body sensation and blurred vision. Ocular signs, congestion in about 71%, though cornea was not clear only in 66.7%, but on FS staining we found that about 74% had one or the other form of corneal staining. So the different staining patterns included superficial punctate epithelial erosion, small punctate dots, large punctate dots, and filamentary lesions. So the lab parameters showed a decreased total count with a lymphocytopenia. IgM measles was positive in 3 cases in suspected cases. And these were the treatments given. The systemic evaluation was done by 2 separate physicians. So half of our patients received vitamin A, and IV cephalosporin and systemic steroids in selected cases. And the ocular treatment included lubricants, antibiotics, and topical steroids. So coming to the discussion, the most recent measles outbreak in India was reported in Maharashtra in 2017, where the children were being the most affected group. But our cohort consisted of immunocompetent adult patients. A 2020 study which reported almost equal involvement in conjunctiva in our studies also almost 70.8%. The rate of keratitis was only 50% in the previous studies, but our study, although 7% had corneal changes, but on slit lamp evaluation about 4% had corneal involvement. So compared to previous studies, there is an increased incidence of keratitis in these cases. And 50% of our patients received vitamin A as a part of their treatment regimen based on the attending physician's preference. But no conclusive evidence from clinical trials to support the efficacy of vitamin A in preventing blindness in measles. And interestingly, 3 of our patients exhibited corneal involvement without concurrent conjunctival inflammation, suggesting that a thorough ocular evaluation should be performed in all measles patients. So limitations include there was a recall bias in vaccination history because most these patients were in the adult age group, and this was a single center study. So we know that ocular involvement in measles is a well documented, typically manifesting as conjunctivitis or keratitis. But what my study adds, this outbreak underscores the critical need for comprehensive epidemiological and laboratory investigations in suspected measles irrespective of the vaccination status. And the physician usually manages the eye conditions because these patients generally go to the physicians. But the management of keratitis requires particular caution. Initiating steroid treatment without a proper slit lamp evaluation and ongoing monitoring can lead to complications such as corneal thinning and increased intraocular pressure. And it is essential for ophthalmologists to be actively involved in the care of measles patients, even in the absence of overt eye symptoms, to ensure appropriate management and prevent potential complications. So in the future, research is needed to better understand the factors contributing to vaccine failure and the ocular manifestations of measles, especially in adult population. And future research should also explore the relationship between antibody titers and the occurrence of keratitis. So to conclude, there has been a resurgence in measles which was once thought to be under control, thus posing a significant challenge to public health, and despite widespread vaccination, a notable proportion had keratitis, and concurrently a substantial this had keratitis and necessitating a deeper understanding of this mechanism. Thank you.
Nice study. Your most common ocular sign was cornea not clear in 60% cases.
66% had relatively clear cornea, but on a fluorescent staining, about 71.9% had corneal involvement. There was staining positive. Thank you.